I have to say first, before we speak of the side effects, and all medicines have them, that the side effects I've dealt with in previous medications, particularly those that are prescribed that have an amphetamine base, that have been used frequently in the past. Many of the doctors call those legalized speed. Many patients have gone to clinics and gotten those. They have tremendous side effects, tremendous danger to their heart and their heart rate, rapid heart rate, jitteriness, all those things that make them very uncomfortable. And at the end of the day, those patients are still hungry. The side effects that we deal here with, remember, I told you the medicine is secreted naturally by your intestines. It's a simple protein called a peptide, simple protein. And so all the side effects have to do with gastric. They're all GI. The first 2 weeks, I always tell patients to anticipate maybe just a couple of episodes of some loose stool, very mild, but that's fairly consistent. Some patients, very rarely, in my personal experience, less than 5% will have a little bit of nausea, but we head that off by combining and adding a medication that helps with the nausea, Zofran. And so we supply the patient with that. Very, very low risk. It's very interesting that later, after you've been on the medication for about 4 to 5 months, it may transition into a bit of occasional constipation. You may have some very mild indigestion. But when you look at the benefit, I've never had a patient come back in and stop. Out of greater than 900, I've had less than 5 that stopped because they had nausea that was just a bit too much for them, or diarrhea they could not control. Very, very rarely. Now the target dose of the medication is 1 milligram. And the way that we combat those side effects is we start very slowly. The medical term is titrate. So we'll titrate the patient at 1/4 of a dose for the first 2 weeks. Then we'll go to a half dose for 2 weeks. And then we titrate and move them up to the full dose. By doing that, the side effects are basically a non-issue. On occasion, if we have someone that has a little more diarrhea or a little bit of nausea, we just slow down the titration schedule, and we'll keep them at 1/4 dose, for example, 3 or 4 weeks, or a half dose 3 or 4 weeks. So they're really comparable. In my career, the side effect profile is extremely minimal.